I'm going to ask you, Dr. Houchin, about how does all this relate to pediatrics? Are these same rules apply if it's my child? I know that Marcia was just saying she has a sick child at home, but as a mom, if I come to the doctor and don't get an antibiotic, is that okay sometimes?
Well, I was actually sitting here thinking that because my rule at my clinic is if a mom thinks their child needs to be seen, I see them. I mean, we work in any child that comes in the office, at least the front office is supposed to know we see them, because it's really scary to see a kid, especially if it's your first kid, but sometimes it doesn't matter, first, second, third kid. If they're, sometimes I've seen a kid and they look just fine, but an hour ago at home they looked really sick. They were having trouble breathing. They were more congested in the chest. So I think that anytime a mom is concerned, take them to your local doctor, take them to their family doctor, and let us just look at them. But don't always have the expectation that you have to go home with a medication that's prescribed. It's hard as the physician not to want to give you something because you've brought your child in. But if you're the parent, realize that there's a lot of times that you can just treat with the Tylenol or with a little something for the allergy. Kids under 2 now, we have very few products that are actually available that we can prescribe. And so a lot of times we will just say use the saline drops and use the bulb syringe. Use the Tylenol if they're running a fever or seem to be having some aches and pains. But if we say that, what I usually follow up with that is, look, I worked them in today. If they're not feeling better tomorrow, I'll see them again tomorrow. I'll see them again the next day. I'd rather see them every day and me feel comfortable that they're healthy and are not really a sick child that needs an antibiotic, and make the family and the parent feel like they don't need the antibiotic, rather than just giving them one and sending them home and they may not actually have needed that medication.
Right.